Hello, this is Dawn Monahan covering the lecture Career Paths in Nursing, and you can follow along with your PowerPoint that's posted in Moodle and also with your assigned readings for this topic. So, our objectives for this discussion slash presentation is that we're going to talk about the journey or the path, if you will, that nurses take not only to gain entry, and we've already talked about entry to practice earlier in this course, but also just how do you then take those minimum competencies that you've demonstrated throughout nursing school and passing the NCLEX, and then bring them to your first position or your first duties, and then grow them and expand them. So those universal job skills we'll look at professional certifications. How do you certify yourself in an area of nursing? What would be required for continuing education to move forward, and those career paths that lead us to advanced practice? And what does advanced practice look like? What are the options for advanced practice? And then the strategies that you can actually use to achieve those goals. Do you have a map for yourself? Have you begun to think about what's the next step after you leave Plymouth State? I know it feels early, but to have some sort of sense of like, yeah, this is probably not my last educational endeavor. And then we'll talk a little bit about professional nursing associations, their relevance, how they rose up, why they're necessary, and why you might want to join one after you graduate. And then finally, we'll end on that career map. So, some definitions that you should be familiar with just to move through this reading and conversation. And some of those universal job skills that are listed there is things that we know literature tells us nurses would need to possess in order to not only function minimally in practice, but also if we want to be successful through the years and as we grow our practice. There's a reason we call it practice, and that is both medicine and nursing will call it our practice because we're practicing. We meet minimum competencies, we are able to demonstrate that we are knowledgeable, that we make good decisions clinically, and that we are safe and that we protect the public at large. But make no doubt about it, we are always learning, we are always growing. There's so much for us to learn. So when we talk about general nursing practice, we're talking about that minimum entry. And we talked about this a few weeks ago, and that is that we've somehow completed coursework, a degree, whatever you want to call it, degree or coursework, and it's usually going to be either an associate, a baccalaureate, or perhaps one of those few remaining diploma, likely hospital-based programs that can be out there. We've met that coursework requirement. We've received or been conferred some sort of a degree. We have then obtained licensure by passing the NCLEX and understanding what NCLEX is, and then we then hold a registered license that's registered in the state in which we obtained our licensure. In order to understand where this conversation is going, we then are going to explore how do we advance our degree? How do we advance our practice? So, likely, if we're going to become advanced practice nurses and move on and advance our education, it would be the pursuit of a master's degree or some sort of doctoral preparation. Hood has an article, and it is cited at the end, that talks a lot about the progression of advanced degrees that I'll refer to. I also want to give credit here at the beginning to Professor Emeritus Sandra Van Gundy, who also had a student of Masters of Nursing Education with her, who developed a large portion of this PowerPoint, and I have been granted permission by them to use it, or by Professor Sandra Van Gundy. So some degree options, we've reviewed these already, are right there. Your associate's degree, your baccalaureate degree, which is what you are currently enrolled in, diploma nursing, which can be anywhere from 2 to 4 years, depending on how the programs run, full-time or part-time, and then the master's level, and then the doctoral level, which we'll talk about in a minute or two. The other consideration when we talk about career paths and advancing our practice might be obtaining certifications. So, not all nurses will move beyond their baccalaureate or their associate's or diploma, but they choose an area that's highly specialized where they might be able to, with a number of years of practice and coursework that's relevant to credit hours, be able to sit for a certification so that they can become certified in that particular area of nursing. It demonstrates expertise, so that specialized knowledge and skill. And they would take specific courses through the accrediting body, and then they could sit and take that exam. So again, there's a wide variety. There are some certification exams that you can take in nursing that, minimum would be about 4 to 8 hours online, taking some modules, some post tests, completing 40 to 80 hours with somebody else who's certified, and then you sit and take the exam. And that's wonderful because it really is a real small little pocket that you're getting certified in. Or it could be as wide as, let's say, your RNC, which is a certification in nursing that is a very particular area. So for the area that I practiced in, it would require a lot of online learning, a lot of at-home studying, a lot of verifying of many, many hours. And then the exam itself is pretty arduous to take. So there's a link there that you can actually see all the available from the American Nurse Credentialing Center or the ANCC, and all the different tests or certifications that are possible. When we talk about specialties, we're talking about actual specialty areas, which is a little bit different than certifications. Certifications verify and validate that a nurse has taken an exam and can display or demonstrate competency in areas that they now are certified that they have expertise. When we talk about specialties, we're talking about the areas of nursing on a little bit larger scale that we choose to eventually go into. So a lot of your Journal 4s, as a matter of fact, almost close to half the class spoke about the OR. So many OR nurses, if that's going to be what you want to do, that becomes your specialty. And then they go on and certify and get certification. And they can be all different certifications for what type of OR nursing you want to do, whether it be ambulatory, whether it be intraoperative, cardiac surgery. It really gets pretty finite, but it's still a surgical specialty. Then what happens is that professional organizations will surround themselves around these specialties. So in the area that I practice, which is primarily like at the top, an obstetrical setting, it then breaks and branches off to, well, if you're obstetrics, are you a labor and delivery nurse? Are you a mother-baby nurse? Are you a neonatal nurse? And what you would find if you did that research is that there's specialties that actually cover certifications that actually cover, and professional organizations, the very particular parts of the larger body of obstetrical nursing. So it can get pretty muddy sometimes in saying, well, what organization do you want to belong to? So like for myself, I belong to two, and that's NAN and AWHONN. AWHONN is the the Association for Women's Health and Newborns, and it tends to speak to a wider breadth of nursing practice as it pertains to mothers and babies. It's why I chose that area, because it's what I teach and I cross over in my practice. I do mother baby, I do some lactation, I do neonatal. But then NAN is a National Association of Neonatal Nurses. It is specific to neonatal nursing. All of this falls under the obstetrical branches. And as a specialist, I have concentrated my practice in the area of obstetrics, but I professionally belong to those two different organizations. So, understanding that and understanding why they exist, why do we have these specialized organizations, it really is about bringing the profession to the highest level possible through research, education, dissemination of education. So moving from there, we can then talk about if a nurse wants to certify, specialize, they can also elevate their actual scope of practice. Now, if I hold a baccalaureate degree or an associate degree or a diploma degree, and I am able to practice and move into a specialty area, I become specialized, and then I can become certified by taking some of those credentialing exams. But it doesn't change my scope of practice. I still practice within the law, within the Nurse Practice Act of the state, and I am just basically a specialized, very knowledgeable nurse. If I'd like to expand my scope, meaning I want to do more with my practice, well, then I'm going to advance my practice. And if I'm going to advance my practice, which means I'm opening up new doors, so to speak, then I'm going to have to go back to school. And that is what an advanced practice nurse is, or an APRN. And I have a link there that the NCSBN has a short, it's not terribly long, brief video on really what is the role of an APRN. So I want you to click on that and take a look at that. But it sort of explains like why do nurses go on and what can they do. So advanced practice nurses, some of the examples that you're probably familiar with would be a nurse practitioner. So a nurse practitioner has to go back to school and obtain higher degrees. So that's an example of an advanced practice nurse. A clinical nurse specialist, which you call a CNS. This is a nurse who typically specializes in one area. Oftentimes, clinical nurse specialists, the ultimate purpose for a CNS would be to be an educator on the unit. So the nurse educator right out on the floor within the unit or the ward. There is a trend that that CNSs are not being used anymore, and CNLs, which is more of a generalist, are being used to cover many areas for training. It's controversial, and like anything in nursing, nobody can seem to agree on what we will do, because although I'm an educator, a nurse educator, and actually my advanced degree is in nursing education. So I have a master's in nursing with a track in education. So my focus of studies, once I went through my core master's work, was on how do I teach the next generation of nurses. And that's what the coursework helped me learn. It's different than a CNS. So could somebody like myself, if you really wanted to get technical, take that degree, move out to a unit, and teach people on a unit? Where's my expertise, right? I could likely do that in an obstetric setting, but could we cross it back over the other way? Could somebody who's a CNS come into the classroom and really understand pedagogy, and that is how do students learn? That's actually not taught as comprehensively in a CNS track. The certified nurse midwife is another example, right? Advanced education, masters or higher, and you have to sit for another licensing exam, much like nursing. And then the CRNA, which is the nurse anesthetist, would be another great example. So the nurse practitioner being the one that probably most of you can refer to, we're talking about the largest group, about 205,000 in the nation, plus more than that. And really, what makes them different from a nurse? Well, a nurse practitioner is taught how to do a more in-depth diagnosis assessment, but they will also contribute to diagnostics. They can write orders for diagnostic tests. We can't. They can write orders for lab work. They can write prescriptions. We cannot. So they begin to look at the medical aspect of the patient's well-being or health or fractured health, whereas we look at how does health impact our patient. So they are nurses, and they still take that into consideration. They don't lose that. I'm going to stop here, and in the next segment, we'll pick up talking about other advanced practice roles.